Welcome to Monday's edition of COVID-19. We are starting the work week with more than 600 new infections despite the fewer tests conducted over the weekend. Also this week, hopes are high for a vaccine swap deal between Seoul and Washington as leaders of the two countries come together for talks on Friday. Now, we have more on this later on in the program. We start now with other news. It's been about 2 weeks since COVID-19 self-testing kits have been available to the public. So have they been helpful or harmful? Well, here is what the public is saying.
Starting this month, COVID-19 test kits have gone on sale at pharmacies, supermarkets, and convenience stores across the nation.
전화로 먼저 많이 문의를 해주시더라고요. 지금은 일단 20개가 먼저 들어왔고요. 추가적으로 한 100개 정도가 더 들어올 예정이에요.
The kits are used by first inserting the swab into your nostril, then placing it onto a test strip with diagnostic fluid. After only 15 minutes, red lines will appear to show the results of your test. These new at-home test kits have the advantage of being less painful and quicker compared to the standard PCR test. However, self-test kits have a lower sensitivity rate compared to PCR tests, with the latter being 98% accurate. The lower sensitivity rate corresponds to more false negatives, prompting health authorities to emphasize that self-test kits should be used as supplementary tools only.
보조적 수단으로 사용하는 것이 원칙입니다. 방역 수칙은 반드시 준수하고 감염이 의심될 경우에는 유전자 검사를 별도로 확진 검사를 받으시는 게 필요합니다.
But what led the government to approve these kits, despite the wide availability of free PCR testing across the nation?
방역당국의 입장에서 무증상 감염자는 사실 표가 전혀 안 나는 사람이니까 당신 와서 PCR 검사를 하세요 라고 강제할 방법이 없습니다. 그래서 사각지대로 지금 방치되어 있는 부분이기 때문에 이런 무증상 감염자를 효과적으로 찾아낼 수 있는 유일한 방법이 이 자가검사 키트고요. 다만 개인이 검사하는 것보다는 이 직장인이나 또 자발적인 모임들, 사회단체들이 사회단체와 직장이 중심이 돼서 사업주의 주관하에 혹은 단체장의 주관하에 주기적으로 반복적으로 전수를 검사하는 것, 이렇게 하는 것이 바람직하다고 생각합니다.
The use of self-test kits is still one of the quickest ways to detect asymptomatic patients among a large group of people. UK regulators have also approved at-home test kits for this exact benefit. But the accuracy of the kits remains a source of controversy in the UK, with a recent study by the University of Birmingham on 8,000 students showing a sensitivity rate of only 3.2%.
The sensitivity for this particular lateral flow test that we use ranges from 58 to 79% depending on who is actually performing the test, whether it may be a trained healthcare staff or individuals who are following step-by-step guides. Even though the MHRA have approved the use of the lateral flow tests at home, they emphasize that the negative test results should not be used as evidence for people to start being less cautious of the current situation.
Meanwhile, the US is now accepting negative results from self-test kits for travelers entering the country, so as long as the kits have been approved by the FDA. The kits are also being rolled out on a trial basis here in Korea at a number of high-risk venues. Experts say there's work that remains to be done in order to maximize the benefits of self-test kits.
이 키트를 씀으로써 피해를 보지 않아야 돼요. 한마디로 이 키트를 써서 위음성에 나오는 사람들도 전부 다 와서 PCR을 받아야 되거든요. 그렇게 보조적으로 사용하기 위해서 필요한 거는 이 자가진단 키트를 사간 사람들에 대해서 추적할 수 있는 시스템이 필요하고, 그 다음에 그 사람들이 결과를 입력하게 만들어주는 시스템이 필요하거든요.
Remember that these kits should be used on a supplementary basis only, and that they are not a replacement for PCR tests, and more importantly, the role of active prevention.
Right, up next, we'll bring you the broader pandemic coverage with our Kwon So-ah, who is here at the desk with me today, owing to some technical issues with the display panel behind her. Welcome, So-ah.
Hi, Sunny.
Right, then let's start with the domestic updates.
Sure. Well, we've got a quite concerning figure this Monday. 619 infections were confirmed as of 12 a.m. And we also have close to 600 domestically transmitted cases at 597 with 22 imported cases. Now, infections have been in the 600s for the third straight day now. And today's number is in particular of concern because considering it's the day after the weekend when we usually have fewer tests conducted, because last Monday we had cases in the 400s and the same the week before. So that is quite an on-week jump that we are seeing this Monday. And in the capital, Seoul, almost 200 cases were reported, followed by 150 in Gyeonggi-do province. Also 35 cases in the Gangwon-do province in the city of Cheolwon, which involves a dozen of soldiers that have been confirmed with COVID-19 there. And the total number of cases stands at 132,290 here in the country. We've also reported 3 additional fatalities, raising the death toll to 1,903. Let's also get a check on the vaccine updates. We've got around 3.7 million people in the country having received at least one shot of the vaccination. Here we see the numbers, and also 940,000 people with a second dose. So 7.3% of the nation's population got the first dose, and also 1.8% already received their second dose. Now, beginning this Monday, the government will compensate people with post-inoculation symptoms with up to 10 million won, or a little less than $9,000, even if it is difficult to prove any correlation between the vaccine and the adverse responses. Now, amid some confusion and caution over in the U.S. recently regarding mask recommendations, the CDC's head said science right now shows that it's safe for fully vaccinated people to take off their masks, but the latest loosening is not a permission for everyone to do so everywhere.
I see. Also on the international front, so I understand Taiwan and Singapore are facing setbacks in their COVID-19 containment efforts.
Right, Sunny. The two countries, which are some of the few that have been widely praised for their containment efforts, now are on high alert. Now, Taiwan confirmed at least 206 new local transmissions on Sunday, spread across 8 cities and counties, following 180 cases the day before. Now, those are the highest ever single-day figures since the beginning of the COVID-19 pandemic. Now, authorities responded with the strongest ever containment measures, including a partial lockdown in 2 cities, including the capital, Taipei. Now, Singapore reported 38 community infections on Sunday, the highest in over a year. Now, 7 of those were preliminarily identified as the Indian variant. Stringent new measures there include a cap on group gatherings resized from 5 to 2 people, and beginning Wednesday, most schools will be shut down. And let me also give you some updates on some countries much worse hit than Taiwan or Singapore. Of course, India now at 24.9 million infections reported, over 281,000 new cases. But the good development here is actually that this number is below 300,000. That happened for the first time in 25 days. And last but not least, the total number of cases around the world stands at 163.7 million, with over 550,000 new infections reported, and also over 10,000 fatalities were added in the span of 24 hours.
All right, so thank you for that for now. We'll come back to you after the briefing then.
All right.
Right, well, it is time now for the regular briefing on the COVID-19 situation here in Korea for this Monday. Now, many people have reportedly been venturing, or choosing to venture, that is, to indoor venues amid the rain here in this part of the world in recent days. So do keep your face masks on and do seek to limit your time within enclosed spaces, given the risk of COVID-19 transmission in the absence of proper and frequent ventilation. And speaking of ventilation, do seek to allow for a fresh and healthy flow of circulation, that is, of air, when at home as well. Now, while we wait for the briefing to start, here are a few words related to possible discomforts after COVID-19 vaccination. First then, feeling uncomfortable for up to 48 hours post-inoculation is said to be normal. This is reportedly one indication that the vaccine is working. Common side effects include pain at the site of injection, fatigue and headaches. So secondly, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, while for fever, drink plenty of water. If you need to take a painkiller, most doctors recommend Tylenol, as it is the least likely to interfere with your immune response. Thirdly, should your discomfort worsen, be sure to dial 119. The briefing is about to start. We'll come back to you afterwards.
I am Commissioner of the KDCA, and let us now begin our regular briefing for May 17th, Monday. And as for the prevention of COVID-19, I cannot highlight more the importance of COVID-19 vaccination. And especially for the senior citizens aged over the age of 60, we know that the COVID-19 infection could lead to fatalities or severe critical conditions. So it is very fatal. And here in South Korea, about 95% of all of the fatalities related to COVID-19 are aged over the age of 60. However, these can be prevented with the vaccination. And already here in South Korea, people have received the vaccines, and we have been looking at the efficacy, and about 89% of efficacy rate have been proved. And also, even if they are infected by COVID-19, even after inoculation, we see that we can prevent fatalities. And also, starting from February, late February, we have been rolling out the vaccines here in South Korea, and we have seen 16 cluster infections stemming from the nursing hospitals. However, this has decreased to 6 in April. And lately, we have seen a related cluster infection in Daejeon City. However, we say that there has 2 weeks have been passed after the inoculation, and they have developed immunity, and we have been preventing the virus to about 92%. And similarly, in Gyeonggi-do Province, Seongnam City, we also see, despite these related cluster infections, we see that recipients of the COVID-19 vaccine were not impacted by the virus. So we say that vaccination is the most effective and safest and the most accurate way to prevent yourself from and protect yourself from the COVID-19 virus. So we ask you to get vaccinated as well. And going on, as for the COVID-19 vaccination status, here are some updates. Currently, we have a total of 3,733,806 people who have received their first dose, which is about 7.3%. And there are about 940,000 people who have received both shots. And however, it accounts for about 1.8% of the total population. And as for the ratio of the reservations for the bookings for the COVID-19 vaccines, more than 1.24 million people aged over the age of 70 have finished their booking. And the rate stands at about 49% and 29.9% for those aged between the groups of 64 and 60, and also to 60 to 64 respectively. So if you are senior citizens, please book your COVID-19 vaccination appointments, and also you can do so with the help of your children as well. And you can also pick the designated COVID-19 vaccination hospitals regardless of your residential area, and you can also do so at the public local services centers. And as for the vaccination updates, we have a total of 1.43 million doses are now being shipped to hospitals nationwide. And also AstraZeneca vaccines, about 1.68 thousand doses. Today, they have been shipped out from the factory. And also until the June, we also have about 5 million more doses to arrive here in the country. And these doses of vaccines will be used for those aged between the age of 65 and 74. And and they will be shipped to the COVID-19 designated hospitals nationwide, which have been designated to roll out the vaccines. And as for the AstraZeneca vaccines and also the Pfizer vaccines, we have had the initiative of the COVAX facility, and we have about 7 million doses that have already arrived here in South Korea, and we also have more scheduled to arrive here in the country as well. And starting from today, government will provide medical treatment costs to people undergoing post-inoculation severe adverse responses who have deemed to have insufficient correlation with the vaccination. And this means that the government is amplifying and intensifying its responsibility over the people who are experiencing severe conditions after inoculation. And even after the screening process by our expert panel, these cases have been deemed to have insufficient correlation, and they have been excluded from the government initial compensation. However, they will now be subject to these programs, and they will be provided up to 1 million Korean won per person, depending on their severity of the conditions. And next, also, as for the post-inoculation adverse responses, here are some updates. And since the rollout of the COVID-19 vaccines, we have also about 0.47% of the reports, and about 95.8% of these reports have been mild or common symptoms like fever or headaches. And also, as for female, there were about 0.6%, while 0.8% were men. And also between age of 18 to 29, we had the highest report rate, and those aged over the age of 75 was the lowest at 0.01%. And as for the Pfizer vaccines, we have seen that the rate was about 0.15 after first dose inoculation. However, it was about 0.19% after the second dose, a slight higher we see as for the second dose. And as for the senior citizens aged over the age of 75, we have seen both at the first and second dose, they have a similar rate of 0.13%. And the compensation panel has been looking at the screenings of these adverse responses, and until now they have had 12 rounds of screenings, and they have been looking at about 94 fatalities, and also they say that there have been 2 cases that have been linked to the vaccines. And especially during the 12th round, they have been looked at 43 new cases. And as for the 16 new deaths, they have looked at these cases, and the average age was about 84. And Pfizer vaccines were 11, and 7 of them received the AstraZeneca vaccines. And this expert panel have seen that looked at the periods of the adverse responses, and they say that 18 of the fatalities, they had higher chances of the correlation with the vaccine, and also with the underlying medical illnesses, saying that there are unlikely to be the correlation with the vaccines and also these adverse responses. And also there were other underlying medical illnesses like strokes and so forth that have contributed to these fatalities. However, we have seen one case that the screening panel did not see the correlation, and this person will be subject to the new set of treatment cost compensation that will be rolled out to the public starting from today. And despite we have the fact that we have insufficient amount of evidence, we say that also there has been not definite definite cause of the correlation, and this is why we have classified that specific case. And as for the 25 cases of severe symptoms, we have looked at the period of the occurrence of these severe symptoms, and looking at a multi of other various factors, we see that other than vaccines, these were attributed to other factors, meaning that it's probably not related to the COVID-19 vaccines. And we have seen that the other cases were related to other medical illnesses, also including the brain strokes as well. And moving on, here are some updates on our weekly analysis of the COVID-19 virus. And domestic infections on an average for the past week, we have had 590 cases. This is about 4.5% on-week increase. And in the metropolitan area, we continue to see the spread in Honam and Jeju as well. They continue to see regional spread of the virus, which is contributing to an increase of the on-week rise. And in the imported cases, we have seen 27.1 cases during the past week, and this is up by 3.7 from the previous week. Right now, on a global level, we are seeing a slight decline of the daily tally. However, in India and also Southeast Asia, we are seeing these cases accounting for about 52% of the total tally. And we see that there are also high proportion of the imported cases here in South Korea as well. And for the past 4 weeks, we have seen a slight decline in the number of the fatality rate here in South Korea. And right now, our daily average, we see about 500 cases. And we are also seeing more people spreading, a more proportion of the virus spreading with cluster infections, especially for those with the contact with the previous cases, now accounting for about 46%. And this is why we call for the importance of the particular precautions. And also, we have seen an emergence of the UK variants here in South Korea as well, and the local spread as well. And this is why we need to eye especially on the influx of these new variants. And the COVID-19 quarantine officials here in South Korea are also carrying out a close monitoring of the UK and South African and the Indian variants. And we are also intensifying our quarantine measures, especially requiring them to submit PCR testing and making sure that they do not avoid and go apart from their isolated facilities. And we are also looking at the countries that are having the COVID-19 new variants, and also the spread of new variants here in the community as well. And in order to contain the virus, we are also asking the people with clinical symptoms to get tested as soon as possible. And we are also asking for the workers who are working at facilities like the welfare centers for seniors and children to get tested as well. And we are also intensifying our quarantine measures for all of the virus vulnerable facilities. We are asking to get them tested as soon as possible as well. And marking the month of family, we believe that there are many outings and also many people traveling as well. If you have to plan a visit to your family or outings, please limit your group with only immediate family members, and please enjoy outings outdoors. And regardless of where you are, please wear your face mask. And even when you are indoors, you have to also ventilate your space on a regular basis. And if you have suspected symptoms of COVID-19, we ask you to get tested as soon as possible. The quarantine authorities will also make multifaceted efforts to contain the spread of the virus here in Korea. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, there was Chong Young with Monday's afternoon briefing. So what was the gist of her address?
Well, let's start with some general updates. The average number of domestically transmitted cases in the past week stood at 590, and that's up by 4.5% from the previous week. And also the number of imported cases, which stood at an average of 27, has risen from the week before. Now, Chung Eun-kyung, the commissioner of the KDCA, stressed she can't emphasize enough how important vaccination is, and especially for elderly already calling on that age group, the elderly people, for early booking for vaccination. And this can especially be seen when looking at the recent post-inoculation responses. While 0.47% of vaccine recipients have reported symptoms, with most of those being light symptoms, just 0.1% of those aged 75 and above have reported such adverse responses.
I see. All right, so thank you very much for that.
My pleasure.
세계 최고 수준의 백신 위탁 생산 능력과 특수 주사기 생산 능력 등이 큰 힘이 되었습니다. 지금 우리 기업들은 세 종류의 백신을 위탁 생산하고 있는데 앞으로 더 늘어날 전망입니다.
작년에 우리가 보여줬던 그런 연대 정신에 입각해서 현재 우리가 지금 겪고 있는 백신에서의 어려움을 도와줄 수 있기를 저희는 희망하고 있습니다.
Seoul and Washington are poised to hold their first summit on the 21st of May over in the U.S. local time amid the launch of the Biden administration. Among the issues to be addressed is the possibility of a vaccine swap deal. Now, for more on the feasibility of this deal and related matters, I have Dr. David Kwak from Suncheon University Hospital. Good to see you again, Dr. Kwak.
Thank you for having me.
And joining this session virtually is Professor Kim Hyun-wook at the Korea National Defense Diplomatic Academy, that is. Hello again, Professor Kim.
Hello, how are you?
Fine, thank you. Professor Kim, what are your prospects on the upcoming summit talks amid the pandemic? Do you expect COVID-19 to take center stage?
Yes, I think, a lot of agenda is expected to be discussed between two presidents. Maybe North Korea issue might be discussed, but I think what President Biden wants from South Korea desperately is to bring South Korea into the U.S. side to cope with China. South Korea has been unwilling to be a member of Quad, but I think corona vaccine cooperation with the United States would benefit the United States in the aspects of China issues. For example, maybe South Korea is expected to be more cooperative with the United States on other issues like technologies and corona vaccine issues, for example, semiconductor and auto battery issues. So I think this would be a very good give and take meeting for those two countries. South Korea might be able to get some vaccine cooperation from the United States. President Biden, the U.S., I think might get some more active cooperation from South Korea on the issues of dealing with China.
Right, and we'll delve into that later on. But first then, Dr. Kwak, what is your assessment of the inoculation campaign here in the country, including Korea's vaccine procurement efforts?
Well, up to this point, we have had about 7.2% of inoculation rate so far, and that's quite slowly progressing compared to what we originally had planned. I believe we had originally planned to inoculate or at least secure dosage for 180 million dosages, and we have secured about 600 to 700 million dosages so far that is on our soil currently. So in the first half of the year, we're supposed to get the other more than 50 to 60% of what was originally planned. So I think we're getting there. We're slowly progressing, but it's still a long way to go as far as vaccines and vaccine security, securement and then also inoculation is concerned. But I believe even with the 7.2% of the inoculation rate, we're still getting quite a positive results from them, as in lowering of the mortality rate in the elderly population, and also very positive feedback from people willing to get vaccinated once it starts third to fourth week into this month. So I'm hoping to see better results and also better securement of further vaccine dosages.
Right, and staying with that, for a broader look at the possibility of a vaccine deal between Seoul and Washington, I have Thomas Byrne, the president of the Korea Society over in New York, live on the line. Pleasure to have you with us, Mr. Ban.
Thank you for inviting me.
Now, Mr. Ban, you recently wrote an article in support of a vaccine swap deal between Korea and the US. Would you care to share your thoughts with us?
Yeah, I think the U.S. should help its neighbors and it's also its close allies. Now, it already has made a small gesture, a modest gesture to Canada and Mexico in sending some vaccine, and I think it's time for the U.S. to do the same to its close allies like South Korea. Now, the U.S. is in a position. We're in a position now where the supply is becoming more than adequate to meet the demand. Even though a lot more people still need to be vaccinated in the U.S. But the producers are ramping up supply. So I think pretty soon the U.S. would be in a position to meet the domestic prerogatives, to help out internationally, supply vaccine to the COVAX initiative. I believe most of those vaccines will go to the developing nations, but it can also help out its close allies and neighbors as well.
Right. Mr. Byrne, do you expect Friday's summit between President Moon Jae-in and his U.S. counterpart, Joe Biden, to perhaps tangibly advance bilateral collaboration on the vaccine front?
I certainly hope so. I don't know what to expect. I'm not a diplomat, but I think I think we're ready to do that. I think the U.S. is in a position to do that.
Right. And staying with that, Mr. Byrne, how would such a deal reflect on the future alliance between the two countries?
Yeah, well, you know, the U.S. alliance is it's more than just a military-to-military relationship. As important as that is, it's, you know, the U.S. diplomats always say it's multifaceted. So if you look at the example of the Chorus FTA, this was an economic agreement, a free trade agreement between the U.S. and Korea, but the alliance provided an ancillary rationale for going into this economic arrangement. And likewise, we should consider public health support to a country in need as part of the alliance, part of this multifaceted relationship we have with South Korea.
Mr. Byrne, although we hope this vaccine deal to take place, what may perhaps hinder efforts to reach such a deal then?
Well, I guess the first consideration is what the exact, the supply-demand balance is in the U.S. But in the past week or two, reports have come out in the newspapers that supply is increasing relatively rapidly in the U.S. I'm not sure the exact dynamics of it, the mechanics of it. I was aware working for Moody's, when I worked for Moody's, of the currency swap between the U.S. Fed and the Bank of Korea, which filled a dollar gap in the case of Korea, most glaringly back in the 2008 global financial crisis, but also the currency swap was available at the beginning of the COVID crisis to South Korea as well as other sound central banks in the world. So back, in that instance, Korea had a dollar gap. Now it has a vaccine gap, and I think the U.S. could help out. Perhaps it would be modest, but I think it could help out South Korea. Now, I wanted to say one point. Even though it would be modest, and the other panelists said that South Korea is slowly progressing on vaccinations, but it has a long way to go. Only, if I heard the data right, something like 1.8% of South Koreans are fully vaccinated, and the old age population in South Korea is something like more than 16%. Meaning 65 and over. Maybe people who are 65 don't consider that to be an old age. But regardless, is that there's ways that the U.S. could help South Korea, I think.
Right. All right, Mr. Byrne, thank you very much for your time and your thoughts at this very late hour at your end.
Okay, thank you.
Right then, Dr. Kwak, some observers believe that vaccine priority, like Mr. Byrne pointed out, should be given to countries that are facing frightening resurgences like India. They claim Korea, in comparison, appears relatively stable. What are your thoughts on this as a medical professional?
Well, I can't completely disagree with that because obviously, as everyone is seeing, the situation, let's say, for example, in India is much cruel and tiresome compared to what we have here. We have it better managed and we're seeing the numbers that are not, let's say, increasing so rapidly as how it happened in India. So we're better off, to say. But we also need sort of a security measure, meaning we still need to further inoculate, as Mr. Burns mentioned, much more percentage of the population. And in order to do that, we need to secure not just tens of thousands, but at least millions more by the either first half of the year or at least third quarter of the year to really secure, so to speak, herd immunity in the country within this year. And in order to achieve that, not only the secure dosages that we have planned for them to reach our soil within the year, we also need to secure further dosages. And if that could be done through, let's say, swapping of the vaccines with the US, it will be a very helpful gesture from the US, but also it'll be helpful in the long term so that we can pay them back maybe later.
Right, and those are the thoughts of a doctor then. Professor Kim, as a scholar in the field of diplomacy, what are your thoughts on ensuring priority or vaccine priority to countries in need?
Especially when U.S. and South Korea is allies, I think vaccine provision is such an important public goods that U.S. can provide to the needy countries. Now the Biden government's foreign policy is different from Trump government's foreign policies. One of the necessary assets that the hegemon needs to be equipped with is to have a capability to provide public goods to international community. Maybe the U.S. capability is not as big as before. During the Cold period, the U.S. GDP was 42% of global GDP. Now it's only 25%. So maybe U.S. doesn't have enough capabilities to provide, public goods to international community like vaccines. But I think, in order to mobilize allies and partners, and maybe to deal with China, which I think is a priority in foreign policies, vaccine provision is an important part of the U.S. Foreign policy tools, especially to allies like South Korea.
Right. Dr. Kwak, a vaccine swap deal, like the phrase suggests, will require Korea to return or repay the vaccines it receives from the U.S. in the future. What are your thoughts on Korea's capacity to do so?
So I think that's actually the area where we have the strong hand here. As probably Mr. Burns also mentioned before, our capacity to manufacture, what's called CMO, is the capacity to manufacture once the patent is granted to the companies on our soil. We're able to manufacture second best in the world, meaning our capacity is only second to the U.S. in its ability to produce or the amount of production. So if we have been granted certain inoculation, if we were, let's say, lent, in a sense, a certain amount of vaccine dosages now, in the future, or in the near future, actually, once the patent is cleared and once we go into the full manufacturing mode, we will be able to actually provide back in a massive amount the vaccines that other countries or even the US may require in the future because our manufacturing capacity is so huge. So I have a strong belief in that if the swapping deal hits, I think we'll be able to actually provide also back to the US a very great deal sort of in the future.
Right. Professor Kim, the gain for Korea under a vaccine swap deal is clear, but what does Washington look to gain from such a deal?
One of the problems in the U.S.-South Korea alliance is that South Korea has not been very active in participating in the U.S.-centered Indo-Pacific strategy, especially Quad. The U.S. South Korea has been discussing about the role of South Korea in Quad countries. But South Korea was unwilling to be part of the Quad because it is aimed to pressure China, and South Korea wants to have a good relationship with China together. At the Quad summit meeting, the issue areas for Quad countries' cooperation was coronavirus situation, vaccine issue, technology issue, and climate change issues. And also the Biden government's important foreign policy priority is to form a global supply chain in important industry issues, excluding China. And those are the ones like semiconductors and technologies, auto batteries, things like that. So I think in this summit meeting, South Korea might give some sort of support on issues like semiconductor and auto batteries in exchange for getting corona vaccines from the United States. So I think that this summit meeting, the U.S. I think this is a very important critical juncture for the United States to bring South Korea closer to the U.S. side, not the China side, in this U.S.-China competition.
Right. Dr. Kwak, there is talk about a possible vaccine manufacturing deal between Samsung Biologics and Moderna. Now, should this deal become a reality, what impact would it have on Korea's vaccine rollout?
So it's very tough for me to actually personally speculate or anticipate what's going to happen because everything is still in the clouds. We're not sure if the Samsung Biologics is actually going to start manufacturing for Moderna. But if it was to happen, it'll obviously be a very good news for the whole world because, as I said, the CMO, the manufacturing capacity from even just Samsung Biologics is huge. So we will be able to provide not just the US or other countries, but maybe also in the future, if we get the patents cleared and also from the US side, we would also be able to provide ourselves with Moderna. But that's yet to come because, as I said before, nothing has cleared out yet. We don't know we are actually going to start manufacturing for Moderna or not yet. So we would have to see what happens with that.
Right. Professor Kim, this is a question I had asked Mr. Byrne earlier on, but what are some of the obstacles perhaps in the way to paving a possible vaccine swap between Seoul and Washington, do you think?
Well, it depends upon how the U.S. Domestic situation is about the vaccine demand and supply. I know that U.S. domestically has enough supplies of vaccines. And I think this might be the first vaccine swap if it is made between U.S. and other foreign countries, I think. But if some unexpected situation happens in the United States and maybe U.S. might need some vaccines inside, does not have enough supplies for South Korea, that might be a problem. But I think this would be a very good opportunity even for the United States to bring South Korea on the side of the United States. South Korea is situated in the right at the end of the Chinese continent and very unwillingly to be part of the United States in pressuring China. Even forming a U.S. South Korea Japan trilateralism was not easy for the United States. So I think this is a very good opportunity for the United States to provide vaccine and make a vaccine swap deal with South Korea.
Right. And we have some time left, so Dr. Kwak, I'd like to direct your attention to research here and elsewhere about the protection offered by even single doses of the COVID-19 vaccine. What's the latest on that front?
Well, there's really no new updates. We have already from the beginning, many researchers have proved that even with single inoculation, people are almost 90 to 100% protected from severe forms of disease or even mortality. So definitely, the recent studies also mentioning that they were providing 95% protection or efficacy per se, and then also close to 99% of protection from severe disease forms and also mortality. It's nothing new, really. So it also, once again, only reiterates the importance that we all who are available, who are provided the vaccines, should come up and get the vaccines once they're provided. So I would just like to mention once again that it is very important that most all of us get the vaccines when we can. So if you're either message through text message that you'll be available, you'll be given the dosage in this month, you should sign up for it.
All right, Dr. Kwak, thank you very much for your thoughts. And Professor Kim, thank you very much for your time today.
Thank you.
Right, and that brings us to the end of this edition of COVID-19 amid hopes for greater collaboration on the vaccine front between Seoul and Washington. As always, thank you for watching.